Hi, everybody. Welcome. My name is Leah Grofo. I'm one of the dietitians and diabetes educators at Stanford Healthcare. Today, I have the great pleasure to introduce Dr. Tannenbaum. She's a licensed clinical psychologist and clinical assistant professor at Stanford University of Medicine in the Department of Medicine Division of Endocrinology, Gerontology, and Metabolism. She also holds a courtesy appointment in the Department of Pediatrics Division of Endocrinology and Diabetes. As a psychologist with a health emphasis, Dr. Tannenbaum provides consultation and behavioral medicine interventions with people living with diabetes and has experience working with individuals with diabetes throughout lifespan. Her research focuses on two main areas: optimizing technology used to improve diabetes management and understanding the emotional experience of living with diabetes. She has an interest in compassion-based approaches to addressing diabetes distress. And I am sure that you will see this throughout her presentation. I have the pleasure to work with Dr. Tannenbaum in our clinic, and yeah, I really think that this speaks to who she is as a person and what she brings to her practice. If you have questions today, please feel free to put them in the Q&A and we will answer them at the very end. Okay, without further ado, I'll pass it over to Dr. Tannenbaum.
Thank you so much for the lovely introduction, Leah. It's really nice to be here with you all. And thank you for being here and joining on an evening to talk about navigating diabetes burnout. So, as Leah said, I'm a clinical health psychologist. My research and my clinical work focus on diabetes. And what that means is that I'm focused on the emotional side of living with diabetes, on all the other things that go into managing diabetes, in addition to monitoring glucose levels and taking medication. So, let me go ahead here. Ooh. Ooh, why is it not advancing? There we go. Okay. Um, so what I'm going to be talking about this evening are first to give a little bit of a definition of understanding kind of what is diabetes burnout, why is diabetes distressing, um, and then get into some things that can help. We all know that there are many different things that go into managing type 2 diabetes. And well, I guess, any kind of diabetes. I'm going to be focusing a little bit more on type 2 this evening, but I think some of the things I talk about will apply beyond that. But managing diabetes is complicated and burdensome. There's monitoring blood sugar. There's expectations that the person living with diabetes will be making lifestyle changes to diet and physical activity, and then taking medications, sometimes including insulin. And all of this may be on top of managing other health conditions as well. And I wanted to take a moment to acknowledge the invisible mental burden, the thoughts, the worries, and the concerns that someone with diabetes may be carrying around with them. They might be worries about having to start on insulin or another kind of medication or treatment, worries about not being able to keep up with the demands of managing diabetes, feelings of shame or stigma around having diabetes and maybe not wanting others around them to know, and worries about what the future will bring, their long-term health, if someone's going to develop complications in the future. And I wanted to point out that the burden of self-management really is on the person with diabetes. When you look at the amount of time that someone spends each year with their doctor, with their clinic team, kind of at appointments, maybe it's an hour put together. And if you compare that to the time that goes in and the mental burden each day that people put into managing diabetes, it can really add up over the course of the year. There's a lot of things that can be challenging about managing diabetes, and I'm going to get into some of the reasons for that now. the treatments for diabetes can be complicated and demanding and every day. Doing the right thing all the time can be challenging. And I put the right thing in quotes, but you can do everything that you're told, take things as prescribed, and not necessarily get consistent results or get the results that you want or that your doctor wanted. There are no vacations from diabetes. The other thing to note that is a challenge is that someone might not be on an optimal regimen yet. There have been so many advances and improvements with treatment and with monitoring, but they're not perfect. And if you're not kind of on the right treatment for you, that can be challenging to kind of be in that place of trying to figure that out and making changes and trying different things. Another challenge is that someone's environment might make it harder to make lifestyle changes. Like I'm sure many of us can relate to the fact that we have to rely a lot on cars to drive everywhere. So there might be less kind of inherent physical activity in your day. It can be hard to afford and find healthy foods. Also, what a person is asked to do to manage diabetes or the changes or recommendations they may be asked to try may conflict with foods that they typically eat that are either traditional foods or celebration foods, or things that they do with their families. So there can be a lot of challenges to making certain kinds of changes. And then finally, there aren't really inherent rewards to managing diabetes. So doing all of these things, engaging in the intensive self-management that diabetes demands, it doesn't come with any rewards. And I think it's important to remember that's part of what makes it demanding and challenging. So I hope this gives at least like a bit of background on why diabetes can be distressing and some of the things about it that are distressing, but I wanted to give you the official definition of diabetes distress. This came from a paper by Fisher, Polanski, and Hessler several years ago. They've done a lot of work in this area. And in this paper, they define diabetes distress as the worries, concerns, fears, and threats that are associated with struggling with a demanding chronic condition like diabetes over time, including its management, threats of complications, potential loss of functioning, and concerns about access to care. A really important thing to note is that diabetes distress and burnout are not considered what we would call psychopathology. It's not a separate kind of mental health condition that we think about treating in a separate way. What has been advocated increasingly in recent years is that feelings about diabetes, distress, and burnout should be thought of as um, an expected emotional response to living with diabetes, which is a chronic condition, a chronic stressor. So not something to be pathologized, but really something to be normalized and understood as part of it. And this is the statistic, there's been different kind of prevalence rates that have been reported for how common diabetes distress is, but it is quite common. And anywhere from, between 60 and 70% of people with type 2 diabetes at any given point are experiencing and endorsing elevated diabetes distress. So why should we care about diabetes distress and burnout? Well, there's a lot of reasons, but I wanted to note just some things that it is linked to. So increased diabetes distress has been linked to poorer medical and psychological outcomes, like not engaging as much in diabetes self-management. That could look like, having a less healthy diet or being less physically active. It's associated with a lower likelihood of taking medications as prescribed. not monitoring or checking in with one's glucose levels as frequently as is recommended. It's also higher diabetes distress is associated with higher A1C and also reports of worse quality of life. So we also care about diabetes distress, and I think it's important to address the feelings and the emotional burden of living with and managing diabetes because we can kind of think about it on a continuum. Diabetes distress can be chronic, it can stick around for a while. It can also kind of evolve into burnout or become more intense. And in burnout, what we think of as someone feeling really chronically overwhelmed, overextended by the burden of diabetes, maybe getting to have that feeling like, I can't manage this anymore. And when we think about diabetes burnout, that might look like becoming more detached from diabetes management, less engaged with the day to day self care tasks that are involved in managing diabetes. So, whether we're talking about distress or burnout, and wherever someone might be along this continuum at any particular week or month or year of their lives, it's important to address it as part of overall diabetes care. I also wanted to mention some data, some findings from a cross-national study that was conducted now several years ago. The papers are over 10 years ago, but the study was called the Diabetes Attitudes, Wishes, and Needs Study. And it found that while nearly half of study participants reported diabetes distress, only about a quarter said that their provider asked them about how they felt about diabetes. I'm going to share a quote from the authors of this paper concluded that insufficient attention had been paid to psychological aspects of living with diabetes and the potential for individuals to take an active role in self-management. I bring this up to say how you're feeling about diabetes matters, what you're finding challenging, and what you're struggling with. These are very important things to identify. They can be part of visits and talked about with your diabetes provider. So, what are some signs? We've talked about kind of things that can, reasons why diabetes distress and burnout might come up. And now I wanted to talk about how to recognize it. What are some of the things we might look to? And how can you know if it's something that you might be experiencing? So some signs, and these can be of diabetes distress or burnout. They may include either suboptimal or kind of a change, an increase in A1C. That could be due to other reasons as well, but that can be a time to kind of check in and say, okay, what's going on? Is there increased burnout now as well? Missed clinic visits or being less engaged with the visits, and I'm going to say a little bit more about that. Maybe being less proactive or engaged in diabetes management. And maybe there can be other life stressors that can add to the burden of diabetes. So there can be different times throughout a person's life and different stages where distress and burnout may be more common. So, some of the times may include around new diagnosis, during a change in treatment or health status, having to change healthcare providers, but also any life stressors. So having to move, losing a job or changing jobs, things like that can also add to diabetes distress. So I wanted to give an example that comes from thinking about missed clinic visits as what might be a possible indicator of distress or burnout. I think it can be a really common feeling to have that a lot of people have worry when they have a doctor's appointment coming up or they're due to get new lab work. And there might be a sense of, not wanting to have failed and not wanting to let your doctor down or yourself down. So it can feel like the stakes are really high. And I wanted to share about someone that I worked with years ago, actually, when I was in my training. I'll call her Edith. Edith's endocrinologist referred her to therapy because her A1C had been high for quite some time, and she hadn't been scheduling follow-up visits, or if she did come to visits, she might come without her glucose meter, and this was in the days before CGM. So her endocrinologist was concerned and thought, well, maybe she's giving up on managing her diabetes, or, maybe she doesn't want to come see me. Maybe it's not important um, to her. But the reality was actually quite different because Edith loved and respected her endocrinologist. And when I spoke to Edith about her, it sounded like they had a really wonderful rapport, a high level of trust. But when Edith would get distressed and overwhelmed by her diabetes and worried about where things were at, she'd feel like she was failing. And she would really worry about not only letting herself down, but um, not wanting to show her doctor how she was doing, not wanting her doctor to see her numbers. It was really important to Edith to not disappoint her doctor, but you can see how it kind of became a cycle because by not attending visits, by not bringing in her data, and they never kind of got to have that conversation. And her endocrinologist also, it wasn't on her radar either about, well, maybe something else is going on, maybe she's feeling pretty bad about this, or maybe she's experiencing diabetes distress. Um, so the doctor did the right thing by putting in the referral, and we were able to kind of open those lines of communication a little bit more to kind of realize like we're all on the same team and want the same thing, and it's not about judgment of numbers and things like that. So I've talked a bit about some of the signs of diabetes distress, but there is actually a way to measure it. And if you haven't been to diabetesdistress.org, I encourage you to check it out. So you can go online, you can take a questionnaire. There have been several different questionnaires that have been developed over the past several decades to measure diabetes distress, but the newest ones are called the Diabetes Distress Assessment System. So the T2 DDAS is for type 2 diabetes. There's also a T1 DDAS. The one for type 2 diabetes has 29 questions, and they go over kind of the overall feelings of diabetes distress and then get more into specific challenges about certain areas. So here are just some sample questions that if you go on and decide to take this, you'll come across, and it asks you to kind of rate to what extent you agree or disagree with these statements. So things like, when it comes to my diabetes, I often feel like a failure. I worry a lot about developing serious complications from diabetes. I can't escape this sinking feeling that diabetes is eventually going to get me. So, and then if you go to the website, if you take go through the questions and click through, it'll give you a summary report. So I wanted to show you what that looks like too. It shows here that a score, it'll tell you if you have elevated diabetes distress. So anything, an average score of 3 or up indicates high distress, and then moderate distress is between 2 and 2.9. And then it's going to tell you about this. The core is your overall kind of global general distress. But then this newer measure also gets into all these different sources. So, what are the things that are distressing in your life currently with diabetes? So, things like management demands, worries about hypoglycemia, interpersonal issues. So, do the people around you, do you feel supported? Do you feel understood in your life with diabetes? Do you feel supported by your healthcare provider? It also asks about shame and stigma, worries about long-term health, and then finally, access to quality healthcare. Um, as a clinical psychologist, I find this measure very useful to give, usually in, the first couple sessions when I'm meeting someone. I think it's helpful to not only see the core score, but also see there may be areas that are more elevated and areas where someone is having less distress. We can kind of highlight that as well, like maybe something is going well there. Maybe someone has, resources for accessing their healthcare, but they may not feel like they are supported by, friends or coworkers or a spouse. So it can kind of help with figuring out where we might want to spend more time and attention. So I'm gonna switch gears a bit and talk because we've talked about why diabetes is distressing and why burnout can come about. What are some signs, how to assess for diabetes burnout and distress. And now I'm going to switch gears a bit and talk about some things that can help. I mean, and I wanted to start this talk this evening with going over some of the signs of burnout and how to measure it and distress, because I think really the first step is to recognize these feelings, acknowledge them, realize they're there for a reason, they are valid, they're understandable, and that many people share these feelings. So I think just starting there is really important. And one question that may be kind of an entry point to thinking about things that could help, because what could help you, an individual, might be different at different times depending on what's going on. And what could help someone might be, different for different people. So I think ask either, for the person with diabetes to get asked the question or to ask themselves, what is something that's really bothering you about diabetes right now? And we probably could identify, maybe it's a lot of things. Maybe there's something in particular that's especially challenging or distressing in the moment that we can use as a starting point. And then I really like to stress, I think this is so important that with thinking about making any kind of changes or addressing distress or burnout, it's really important to start small. And we want to do this to give more opportunities to create small wins. So, perfection is not the goal with anything, and especially not with diabetes. So, um, and we also know that diabetes management is not all or nothing. Even the smallest changes can have positive results, whether that's to your mood, to your distress level, your feeling of being burdened by diabetes, and also to your health and how you feel. And I think what I also like to emphasize is that it's important to focus on, if we're thinking about trying to make any changes or setting any goals, to keep it focused on the actions that you're taking rather than the outcomes that you want to see. So, less helpful is to have a goal like I want my A1C under 7.5 by November, because so many things can go into that. And some of that might be within your control. Some of it might not be. But we want to say, well, what are the actions? How would we break that down? Even if that's a long-term goal to focus on your diabetes management. Um, so focusing on the actions can look like taking a walk after dinner or taking your medication. Um, Versus, again, like having an A1C goal or saying my blood sugar has to always be under 200. So we want to focus on the actions and then reward those actions. Give yourself credit. We don't want rewards and praise to always to be based on, well, what does the number say? What does the lab say? It's an easy way to be discouraged because it's not always consistent and different days can be different, even if you're doing the same exact thing. But so we want to say, this is hard. starting a new habit is hard, behavior change is hard. And so if you're trying out something new, to give yourself credit for taking that action versus the outcome of the action. And then really like this idea of creating success experiences. So the creator of one of the creators of the diabetes distress scale, Bill Polanski, talks about this too. But it's really about how can you best set yourself up for success? And one of the ways you can do that is by focusing on small, achievable goals, with trying anything new. So if you haven't been in a routine of taking walks, and maybe it's something you've been, hard on yourself about, um, where you've been hard on yourself about, oh, I really should, you know, do more physical activity, and it's been really hard to get started. A small achievable goal, and this could be different for everyone, but it could be starting with a 10-minute walk 3 times a week versus something bigger that's like, okay, I'm gonna walk an hour every single day. Because so the smaller it is, the more likely it is you'll be able to achieve it, and the more likely you are to achieve it, the more likely you are to want to continue doing it and maybe gradually increasing it over time. So the important thing is to meet yourself where you're at, and then also something might seem like it was a small and achievable goal, but it might not have been. And so another really important thing is that if you make a plan and set a goal and it didn't happen, that's totally that I mean, I always say this, that it's really that says something about the goal, not the person who made the goal, and it might be time to go back and, tweak the goal. You want to give yourself experiences of being successful because, as I said, you'll be more likely to do something again and then build on it. Another example of this is, I hear this a lot. Someone who, if you're someone who wears a CGM and maybe it falls off early, or, when the sensor ends, you might not feel like putting on another sensor right away because having that sensor on is also a constant reminder of diabetes. And sometimes it can feel like all that data can contribute to distress and burnout. Um, on the flip side, maybe you know that when you're thinking about it more and you have the sensor on, you maybe are more focused on, making different health choices and or prioritizing physical activity more. So one small goal could be, trying to shorten the gap between putting on one sensor and the next. But another goal could be around, and this is maybe not about success experiences, but about giving yourself breaks from the data, is actually setting some times where you are having some boundaries around, like, I'm not going to look at my data right now. So I wanted to spend a bit of time talking about problem solving because this is something that an approach I really like, and it's an opportunity to be creative, and try to think about ways to get unstuck from things that are challenging, and feel kind of hard to tackle with diabetes. Sometimes when I talk to someone who's experiencing diabetes burnout or has been struggling with, making engaging in some change that they've been wanting to make for a while, I'll hear things like, I mean, I call it kind of negative self-labeling, but things like, well, it's hard for me to do it because I'm just lazy, or I'm not motivated, as reasons why it's been hard to take care of diabetes. And I like to kind of point out and say we really want to be careful around putting those negative labels on ourselves. Because if we really were to look at it, we would probably find that it is not accurate a lot of the times in your life. And it's not helpful, to, talk to yourself that way. And and I think that we could probably find a lot of reasons why it's not the case. So when someone is trying to kind of, they're feeling stuck and something's been hard to do, I really like problem solving because it kind of opens up the discussion and the field of possibilities. Um, So, and there's a few different steps to doing this. And I also, a thing I really like is it kind of just changes the script and it can change your relationship to what it means to try something new. The first step is to really specifically define the problem. You want to describe it in detail. So often, if I'm doing this in a session, I'll ask a lot of follow-up questions about, the where, the when, is there anyone else around? Really kind of getting at all the details of a particular situation. Because also what could work for, lunch on a Tuesday at work might not be the solution for, Saturday dinner. So if we want to pick a specific scenario that does come up a decent amount and then really try to unpack, well, what are the things that are going on that make this challenge? Then we get into the fun part, which is brainstorming solutions. And at this point, there are no bad ideas. So you can throw anything out there without judging it. And they can be kind of wacky ideas, they can be reality-based ideas, but the point is to get a lot of different things down on the list. Then you weigh the pros and cons. So you literally like have the columns, pros of this solution, cons, and you go through for each one. And I find that this is very helpful and brings up a lot of honest, reasons why, yeah, I told myself that I could, you know, get on that bike and do this big ride, and that was going to be my physical activity. But actually, here are the reasons why, like, here are the barriers that get in the way. And so let me weigh that against some of the other ideas that I had that might feel like they're more achievable or something that I could try first before something bigger. Um, After you go through all of those things, you you pick out one or sometimes more than one to do, and it's really just as an experiment. So, and and you pick it, you schedule it in your calendar because that's gonna make it more likely that you'll try it. But the idea is not to say this is the end all be all of solutions, but that it's something that you're gonna try and be curious about as an experiment. And that the next step is going to be to reflect and say, well, how did that go? Is there anything I want to change about that? Do I want to go back to my list of solutions and, try something else? So I think that this works really well with a lot of different kinds of situations with diabetes where someone might be feeling stuck and struggling. I think it's nice to do it as an interactive exercise, but can totally be done, on one's own as well. Another thing that I haven't really touched upon much, but is enlisting support from your team as a way of helping with distress and burnout. It's important to remember that you do not have to manage diabetes alone. We know that along with burnout can come feelings of isolation in that sense that it all falls on you. It's really helpful to seek and create connections, which can help increase social support in whatever form that feels right for each person. So, and that support could be really directly focused on diabetes. It could also have nothing to do with diabetes and just be something that, being around people who lift your spirits. Um, but thinking about, who's on my team and how am I defining that? And your team could mean it could be members of the clinical team, like your doctor or diabetes educator or somebody else. It could be family, friends, if you know other people in your life who also have diabetes. It could be coworkers. So people who you're around and may have a role to play in supporting you in your health goals or in, feeling better in your life with diabetes. Um, so, maybe talking with your family about what is healthy eating for everyone, making changes together, having a walking buddy. Again, it could just be spending time with someone who you like to laugh with or someone who, cheers you up or kind of gets you into a different mindset. And I think it's just important to acknowledge that, everyone might have a different supporting role. Um, And it can be really challenging to ask for that support. And sometimes we may need to get kind of specific and train the people around us, or give them a little coaching rather, to share with them and coach them on how you want to be supported. So an example of this could be, you might have family or friends who think that they're being supportive by asking someone that, asking you, "Oh, can you eat that? Is this okay?" And trying, that's coming from a good place of them showing concern and care for you, but it may not be received that way, if they're asking those questions when you know and you don't really need those questions. So that might not be helpful, but they may want to, it shows that they care, and there might be some other way that they can be helpful. Maybe it's just that, asking them if it's okay if they don't ask those questions because you got it. But there may be more concrete asks that you might have. And then really just I wanted to underscore that it's so important to create space for feelings. Um, Maybe I'm a little biased as a psychologist that I think that that's important, but I think it's important to acknowledge that this is hard. If you're feeling distress, if you're feeling burnout, it's valid. It's telling you something for a reason. And I think it's okay to say, like, it makes sense and is understandable that you'd be feeling that way. And just to notice that, and then to kind of check in with yourself and say, well, what do I need now in this moment? What does my body need now? I think a lot of times with distress and burnout, there can be the negative self-talk that comes along with that. But we know that that talk and, being hard on ourselves isn't necessarily going to be the thing that you need or that your body needs. And so, but I think that acknowledging the feelings and validating them um, is a really good first step. And then I did want to share that, in case you weren't aware of this, if you're interested in having a space to talk with someone who understands about diabetes um, and is a mental health professional, the American Diabetes Association has a mental health directory. So you can actually go on this or share it with anyone who might be interested. You can search by, I believe, zip code, and then you can filter by different things. And there's an official training, so any mental health professional who has done the training can be added to the directory. And it's a good way to connect with someone um, who may have an understanding of what you're experiencing of diabetes, distress, and burnout, and be able to provide more support. So that is all that I prepared for this evening, and I'm happy to take any questions. Thanks again for being here.
Thank you so much, Molly, for sharing and yeah, all of your knowledge. I really think that it was so helpful to see you walk through all the different steps. Very, very helpful. You do have questions. Um, this one is asking around a specific thing. So they're asking around meal preparation, how exhausting it's been, and also that it can be tempting to eat out and have more carbs than they want to eat. Do you have any tips around how to minimize that exhaustion and that feeling around some of those lifestyle management things, Dr. Tannenbaum?
I think that is such a good question. And I mean, in reality, I would ask you, is that okay to I I think
Oh,
that
yeah.
that's a perfect question for the two of us together. Yeah.
Oh, yeah. Perfect. I will share my video. Um, Yeah, I think that it can be super tricky to meal prep and kind of figure out what foods you want to eat and the portions at work. Perhaps like this person's using a CGM and trying to navigate and figure all these things out. I think anytime we're trying to look at a change, it's helpful to have somebody like a clinical psychologist, a dietitian, help kind of weed through some of the noise around blood sugar and diabetes and try to really help kind of give some guidance and understand like what you really want to get out of your care. Because sometimes when we're trying to tackle things alone, we don't have a sounding board to really be able to verbalize what our end goal and what we want to happen outcome. And that person can really help to kind of make that. But I will also say sometimes meal planning, if we tackle all of it, can be really tricky. And it makes me think about what you were talking about, Dr. Tannenbaum, about the smaller changes. And if something like meal planning is feeling very large, um, maybe what can you distill down? Maybe that one first goal is a big leap. I don't know. What do you think? That was in your talk I got from today.
Yeah, no, I totally agree with everything you said. And I think if someone's asking this question and it sounds like this is a burden and it's a source of distress. And I also wonder about like there may be some shoulds that it feels like, well, this is the thing that I need to do and that I should do, and it's the right thing to do, but also it sounds like it's exhausting and time consuming, that I might wanna kind of understand more about, like, what is important about meal planning, and do you feel like it is connected with eating the foods that are important, that you feel like you're eating healthier because of it? Um, and maybe look at any kind of creative ways to change things up and make some easier versions of things or other options, and plan Bs for, if it is feeling like too much, because it does sound like we want to go for things that are also sustainable over the long term. And if it's kind of exhausting, um, it feels like maybe there's a more sustainable version, but I think it's a really excellent question.
Yeah, I really liked how you answered that. And that actually answers one of the other questions that we have. Somebody is really asking around how to be consistent with food choices, and then feeling like they might just give up and eat. And so this also speaks to what you were just talking about. Maybe the consistent food choices is at a level that um, is really tricky or impossible to keep consistent. So how do you reevaluate that? That's what I'm hearing around this topic. Is we always set these things that are really tricky to achieve by any measure of anyone, then it kind of leads cracks for feeling like diabetes is not going to be able to go well. I don't know. What do you want to say about that?
Yeah, yeah. I think it's a really good question. And I mean, I imagine that there's, probably some ways that someone is feeling and kind of the emotions that are maybe connected with, like, when you have the energy and you're up for eating a certain way versus, that there are connections between some of the choices we might be making when we have more energy, when our mood is, better. And I think, if it feels like the shoulds and that I need to be eating this way all the time, 100% of the time, that leads to the like, well, that's actually really, really hard to do. I mean, I think, Leah, you and I, like, we are very much on the same page about like meeting someone where they're at, and are there things that they're really missing, and are there ways to kind of reintegrate some of those things in ways that still feel like consistent with their overall health goals, and so not maybe being so like all or nothing about some of those things.
I realize that not all or nothing. It can be really helpful to sit across from someone, um, and really like figure out what are those things that are that you like, how you want to live your life around blood sugar, food, different things. Here is another question that someone's bringing up. Kind of, I think they're kind of trying to get at the nuts and bolts, like how do you bring this talk this topic up with your provider around your feelings. If you feel like your visits are very numbers based, how do you bring this
Mm.
up?
I mean, maybe there's no easy way, and I'm sure it's gonna depend on each person and how comfortable you feel with your particular provider, and kind of if like some providers may point it out first and say like, I can see that there's burnout here, whereas in other cases it might not feel like there's an open door. Um, but I still think, and especially if it might feel like, oh, well, the last, several visits, we kind of have been like saying the same things, or like it doesn't feel like things have changed that much, but this is how I've been feeling, and there hasn't been a space to say that. Um, I mean, I think if you are like going in with the intention, like I think it's important to share. Um, for your provider to know, because I think there is definitely a lot more awareness, and hopefully will be increasing awareness of just the concepts of diabetes, distress, and burnout. That letting them know does open, and then maybe earlier in the visit rather than at the end, does give an opportunity to say, to open that conversation, to say, well, what in particular, what's challenging for you right now? And that may then shift the tone of that that visit in a helpful way, or feel like you um, maybe more on the same page.
Yeah, and I really like how you mentioned like bringing it up at the beginning because it can kind of help inform the rest of the visit. Because I feel like visits go really fast sometimes. And if it's like that last, like, do you have any questions? People are logging off, or, um, and that's when you bring it up, it can be like a little bit tricky to have that conversation because you want to give it space because it's a super valid conversation. So I really like that point. Um, Somebody else is asking, I think kind of the spirit of the question is around like when you're eating out with other friends or being with other friends, how do you sort of navigate this world when you're living with diabetes and have friends who are not having to navigate the world living with diabetes?
Hmm. Yeah, I think that that touches on like a bunch of different things, and it's a really good question. I think it touches on the kind of enlisting your support, and kind of who's on your team, and is that a potential opportunity that if you're going out with friends, like to have them play a small role in supporting you and your goals. Um, I think, you know, it probably is helpful to make a plan, or at least check in with yourself before you're in the situation, about maybe what some of your goals are um, for the dinner. And I'm guessing some of them might be to, enjoy your time with your friends, to be present, to maybe enjoy the meal. And so kind of thinking about and those, like what your intentions might be, and not necessarily like hard and fast rules, but like what your kind of like general, I guess, like intentions are going in, might help with saying like, is this about like how I'm gonna navigate, like, eating at this particular restaurant? Is it about how I'm gonna communicate with my friends who maybe aren't, they don't know kind of the things that I'm thinking about? It could be a conversation even before, like, who's picking the restaurant, if there's places that you feel like are gonna be that you'll have a better time, being at, and, um, and kind of engaging your friends in even in a very small way, um, could be helpful. But again, I think it probably really is going to depend on each situation, and kind of um, what your concerns are, and what your goals are for going, and like, yeah, how. I think it's a good question.
Yeah, really, really helpful. I like how you sort of answer this question, Dr. Tannenbaum, and really centering it back on that person living with diabetes, saying like, what do you want to get out of this interaction or this meal? Instead of like putting that question just like back out, I think it like is a really nice reflection to think about for this meal or many situations that come up, like what is you as an individual, like what do you want, instead of like what do people tell you you should want, like what do you truly want. I like that
Yeah.
that you're mentioning that. I think it's a different way than we normally don't see questions answered in that way, and I think that's something that you bring to the conversation that is amazing. Like what does that person living with diabetes want, which is the most important question when you think about it. Amazing. Well, thank you so much for your talk and everybody for your participation and questions. And this will be posted on the Health Library in probably the next week or so, the recording. And we have another topic next month as well, the second Thursday of the month. For our wellness support group. And there was one other thought that I wanted to have. Oh, I just wanted to really highlight one more, the topic, Dr. Tamwan, when you're talking about the different sort of like actions and really judging a change on an action, or maybe judging is not even the right word, but just really evaluating based on the action, because that's the thing, the behavior that we can focus on, not pounds lost, A1C reduced, because you're right, there's so much noise and different variables that go into that. And I really, that's like the biggest thing that I'm going to take away, to always keep remembering, like when I'm setting goals with people or even for myself, like to really keep that behavior and action based, and not that outcome that I have very little control over. So thank you for that.
Oh, yeah, I think it's a good one to keep coming back to, I think, for all of us.
Yeah, what an insightful talk. And yeah, thank you all for coming. We'll see you next month. Bye.